Okay, I need to tell you something really important. If you're on Medicare or you're about to be, the next few weeks could save you thousands of dollars. And I'm not exaggerating here. Welcome to the Retirement Learning Lab. I'm Van Richards, and today we're talking about the biggest Medicare changes that we have seen in years. And here's the thing, if you don't pay attention during this open enrollment period, you could end up with some really nasty surprises come in January. Before we dive in, I need to give you the usual disclaimer. Everything that we're discussing today is purely educational. This is not medical, legal, or financial advice. I'm here to help you understand what's happening so that you can make informed decisions about your own healthcare coverage. Stay tuned until the end of today's broadcast for more information on the limitations of this information. So, here's what's happening. Open enrollment started on October the 15th and it ends on December the 7th. That gives you a little bit less than 2 months to figure all of this out. And I'm going to be honest with you, this year it is really, really complicated. Medicare Advantage plans are changing in ways that are going to affect millions of people. We're talking about higher costs, fewer choices, and some benefits that you might have been counting on. They're completely disappearing. Now, some of you might be thinking, Van, my plan has been fine for years. Why would I need to change anything? And frankly, my plan's the same way. I'm on Medicare. But give me a yes in the comments if you've thought that, because I used to think that too. But here's why you need to pay attention this year, even if you've been happy with your plan. Over 1.2 million Medicare enrollees are losing their plans completely. The plans aren't being changed, they're being completely eliminated, gone. And even if your plan's still around, there's a good chance that it's changing in ways that could really hurt your wallet. Now, I know what some of you are thinking, Van, why is this happening? Who decided to make my life more complicated? I thought the same thing. Here's the honest answer. Medicare Advantage insurance companies made some miscalculations a few years ago. They came into the market and they underpriced their plans. Medical costs came in way higher than they expected, and some government payments have changed the ways that they're reimbursing these companies, and it makes a big difference. So now, they're making business decisions to protect their profit margins, and unfortunately, those adjustments mean higher cost and fewer benefits for you and for me. Is it fair? Well, I'll let you decide that. But here's what matters right now. We can't control what the insurance companies do. We can control how we respond, and that's exactly why I created something to help you to navigate all of this. Now, because this is so important and there's so much to cover, I've created something really special for you. It's a free comprehensive guide called Your Medicare 2026 Survival Guide. And it's got everything that you need to navigate all of these changes. By the way, did I say it's free? It is. The guide includes a complete checklist for what you need to review in your plan. The exact questions to ask your doctors and your pharmacist. It has a comparison worksheet so that you can evaluate different plans side by side. And I give you links to all the unbiased resources that I'm going to mention today. And lastly, I'm going to give you a timeline so you know exactly when to do what. I'll tell you how to grab it at the very end of this video, but trust me, you're going to want this. It's going to make the whole process so much easier. All right, let's dive in to see exactly what is changing. Let me walk you through the 5 key areas that you need to understand. You ready? First up, out-of-pocket cost. Many plans are increasing the maximum amount that you could pay over the year. Now, this is important. This number is supposed to represent the total that you might spend on co-payments and other different charges. But here's where it gets kind of sneaky and confusing. Even if your maximum out-of-pocket isn't changing, the cost for specific services might be jumping. Hospital stays are a big one. Some plans are increasing the daily charge that they charge for the first 5 days of the hospital stays by hundreds of dollars per day. Let me give you a real example so you know what I'm talking about. One enrollee saw her hospital daily rate jump from $395 to $550 a day. That's an extra $155 every single day for the first 5 days if she needed to be hospitalized. And her premiums, they went from $0 to $48 a month. Think about that for just a second. That's over $500 per year just in premiums. And that's before she even used any health care. Here's the second big change, and this one makes a lot of people really upset. Access to their doctors and hospitals is shrinking. Medicare insurers are cutting back on their PPO plans. These are the plans that give you more freedom to see the doctors that you want. Instead, they're pushing people toward the HMOs, which have a much more restrictive network. What does this mean for you? With an HMO, if your doctor isn't in the network, you're probably not covered at all. And here's what's happening. Hospitals are dropping out of Medicare Advantage networks left and right. I want you to imagine this. You've been seeing the same doctor for, let's say, 5 years. You trust them, they know your medical history, and suddenly, in January, your plan doesn't cover them anymore. That's what's happening to people all over the country. So here's what you need to do. And I mean, you need to do this today if you haven't already. Check if your doctors and your hospitals are still in your plan's network for 2026. Don't assume that they are. Pick up the telephone and call your doctor's office directly. Don't just rely on the insurance company's directory because these are always changing and they can be inaccurate. And by the way, all of this, the exact questions to ask and how to verify your network participation, it's all in the free guide that I created for you that I'm going to give you at the end of today. The third area where things are changing, your prescription drug coverage. And this one is a really big deal. The number of standalone Medicare drug plans, what we call Part D plans, is dropping dramatically. We're going from 464 plans currently available to just 360 for 2026. That's a 22% reduction in 1 year. Regretfully, it gets worse. The plans that are left, they're more expensive. Drug deductibles are going up. In some cases, they're jumping from $420 to $600. That means that you're paying $180 more out of pocket before your coverage even kicks in. And here's something that you really need to watch for. Some of the medications that used to have a flat copayment, let's say the $10 or $20 per prescription, well, they're switching to something called coinsurance. Coinsurance means that you pay a percentage of the drug's cost. And here's why that's a problem. First, it's usually more expensive than the flat copay. But second, and this is important, you can't predict what you're going to be paying. The cost of the drugs are going to fluctuate, so your out-of-pocket cost becomes a moving target. The fourth thing that's changing is all those different perks that you got used to from Medicare Advantage plans. Many of them are just going away. Now, for years, these plans have been adding benefits to attract enrollees. Things like gym memberships, grocery allowances, over-the-counter purchase benefits, even fitness trackers. Some plans were giving $50 a month for healthy groceries. Well, guess what? A lot of those perks are being completely done away with. Now, I know you might be thinking those are just nice to haves, but if you've been counting on that as a grocery allowance or maybe a gym membership, losing it could be a real financial hit. And here's the fifth thing that's changing. This one's kind of sneaky. Insurance brokers and agents are being paid less commissions on certain plans, especially for those Part D drug plans and the PPO plans. Now, why does that matter to you? Because if a broker isn't going to be paid to recommend a plan, they're probably not going to tell you about it. even if it's the best plan for your particular situation. This is why you can't just rely on an agent or a broker to find the best option for this particular year. You need to do your homework on your own, and I'm going to help you do that. Okay, let's pause for just a second. I've thrown a whole lot of stuff at you, and you might be sitting there thinking, this is frustrating. Why are all these changes happening in the first place? Look, it is frustrating. Here's what I think's really going on. Insurance companies are reacting to a financial squeeze. They're dealing with higher than expected medical cost, regulatory changes, and pressure from Wall Street. That's the healthcare company shareholders trying to squeeze profits out. Could Congress step in? Maybe. Could the companies absorb the cost for themselves? Possibly. But we can't sit around waiting for them to change their minds. We can do something important, and that's be diligent. Now, I don't know about you, but when I'm facing a big change in my life, I get a lot of encouragement from the Bible. And I know to each his own, but I thought I'd share this idea with you. Proverbs 21:5 says, "The plans of the diligent lead surely to abundance." Being diligent means understanding these changes and making wise decisions with the information that we have. That's exactly what we're going to do right now. Okay, so those are the 5 big changes. Now, let me tell you exactly what you need to do about it. I'm going to give you a 4-step action plan. This is simple, but you have to actually do it. This is an entire action plan with detailed instructions for each step. And it's in the guide that I mentioned to you. Are you ready? Step number 1, review your annual notice of change. If you're currently covered by a Medicare Advantage plan, you should receive something called an annual notice of change. Now, that document tells you exactly how your plan is changing for 2026. Don't ignore it. Now, I know it's dense and it's boring, but you really need to read it. Pay special attention to your monthly premiums, your out-of-pocket maximums, your cost for your hospital stays, your drug deductible, whether your medications are switching from co-pays to co-insurance. Now, in the guide that I've created for you, I've included and I've highlighted a checklist of exactly what you need to look for. Step number 2, check your doctors and your medications. This is really critical. Go to Medicare.gov and use their Plan Finder tool. It's free, it's comprehensive, and it shows you every plan that's available in your particular area. When you're on that site, enter all of your current medications, every single one. The tool will show you what each plan could cost specifically for those drugs. Now, this is personalized data specifically for your situation. It's incredibly valuable. And don't forget, call your doctors directly and ask if they're in the network for the plans that you're considering. This is an important thing that you need to not guess about. Okay, here's step number 3. Look at all your options. Here's what I want you to do. Even if you love your current plan, I want you to look at least 3 other options just to compare. Maybe you need to consider switching from a Medicare Advantage plan to a traditional Medicare with a supplement. Traditional Medicare usually gives you access to any doctor who accepts Medicare, which is almost everybody, but not everybody, so you need to make sure you do check on that. But you'll need to add a Medicare supplement plan. It's also called a Medigap, and those can get expensive, so you have to be cautious and shop for those. The thing is, if you didn't get a Medigap plan when you first became eligible for Medicare at age 65, you might be refused coverage right now, or you might have to pay a higher rate because of a pre-existing condition. But it's still worth considering. In the guide that I've created for you, I've included a comparison worksheet that makes it super easy to evaluate different plans side by side. Okay, and step number 4, the last one, get unbiased help. You know what most people don't know exists with Medicare? Every single state in the United States has something called the State Health Insurance Assistance Program, or SHIP, S-H-I-P. These are counselors who can help you to navigate Medicare for free. They don't work for the insurance companies. They're not trying to sell you anything. You can find your state's SHIP program really easily. Just enter in the word SHIP and your state's name. Or you can go to the National Medicare Helpline that's run by the Medicare Rights Center that can help you also. Now, use these resources. This is too important to mess up. And yes, all of these resources with the direct links are in the guide that I'm going to tell you about in a moment. Now, I know what some of you are thinking. Van, this sounds like a lot of work. Do I really need to do all of this? Yes. Yes, you do. And maybe you're thinking, Van, whose fault is this? This is a lot of stuff. It makes me angry. Should I be mad at my insurance company, my congressman, somebody? Here's my take on this. There's a lot of factors at play. Insurance companies are protecting their profits. Healthcare costs are rising. Regulatory changes are occurring, and hospitals are leaving networks. But you know what? Pointing fingers doesn't help you choose a better plan before December the 7th. What does is taking action, being a good steward of what you have, making informed decisions. That's why I created the guide to help cut through all this noise and give you a clear path forward. Because at the end of the day, the best response to these changes isn't anger or frustration. It's wisdom and action. Listen, I get it. I'm on Medicare too. Medicare is confusing. The documents are boring. You'd rather do literally anything else. But, here's the reality. The wrong Medicare plan can cost you thousands of dollars. And once you're locked into the plan, you're stuck with it for a whole year in most cases. There's no do-over in March when you realize that the medications aren't covered or your doctor's not in that network. Some of you also might be thinking, my broker has always taken care of this. Well, maybe they did. But remember what I told you previously about commissions being cut. Your broker might not even show you all the plans that would be best for you this year. You have to take ownership of this decision. This is exactly why I created the guide, to help you through this process to make it as painless as possible. You don't have to figure all of this out on your own. I've done a lot of the heavy lifting for you. Here's the thing. Open enrollment ends on December the 7th, and that's coming up fast. And I'm telling you right now, don't wait until the last week. Why? Because everyone else will be trying to get help at the same time. The SHIP counselors, they're going to be overwhelmed. The Medicare helpline is going to have long waits, maybe hours. Your insurance agent, well, they're going to be slammed. The time to do this is right now, today, this week. Set aside a Saturday morning, make a pot of coffee, pull up the Medicare.gov website, get out your medication list, grab the free guide that I'm going to give you the address for, and go through this process. The guide is going to even include and suggest a timeline so that you know what you need to tackle first and, well, maybe what can wait just a little bit. Let me tell you what this really comes down to. Medicare is one of the most important financial decisions that you're going to make in your entire retirement. Your healthcare costs can make or break your retirement budget. And the reality is this: the Medicare landscape is changing rapidly. What worked last year doesn't necessarily mean it's going to work this year. The plan that was perfect for 2025 might be terrible in 2026. This isn't a set it and forget it situation anymore. You need to review your Medicare coverage every single year during open enrollment. Make it a habit, like doing your taxes or getting an annual physical. Okay, let's recap what you need to do today. Number one, read your annual notice of change if you have one. If you don't, go download it from your insurance company's website. Number two, check your doctors and your medications using Medicare.gov. Number three, compare at least 3 plan options. Number 4, Get help from unbiased sources like your state SHIP program. You can do this. It's a little tedious, sure, but you know what's more tedious? Spending thousands of extra dollars next year because you didn't take a few hours to review your options. Now, remember the free guide that I mentioned to you? Your Medicare 2026 Survivor Guide? Here's how to get it. Go to medicare.retirementlearninglab.com. I'll put the link right in the description below, and you can go download it right now. There's no cost to it. Just enter in your first name and your email, and you'll get it. And then you can start using it. This guide is going to walk you through everything that you need to do, step by step. It's got the checklist, the worksheets, the questions to answer, the resources that you need, everything. Now, if you found this helpful, please subscribe and hit the bell icon so that you don't miss any future retirement updates. And drop a comment below. Let me know if you are planning to review your Medicare coverage this year. What's your biggest concern about these changes? I'm Van Richards, and thank you for joining me on the Retirement Learning Lab.